It's time for Wave 3 Listens Live on Kentuckiana's first live local TV talk show, all hosted by John Ramsey. This is Wave 3 Listens Live.
Thank you so much for tuning us in, and welcome to the Tuesday edition of Wave 3 Listens Live. I am genuinely excited about today's show. A couple of my favorite guests are here. We have some giveaways. Kings Island tickets and movie passes. Get ready for that. Something in it for you. Advanced Care Center. You know, we're all about medical advancements, innovations. Dr. Alicia Hall is with me from the Advanced Care Center. And one of my very good friends and someone I respect a great deal from the Physician Center for Beauty. With me is Dr. Sean McGuire. Dr. McGuire, welcome back to the show.
Thanks for having me, John.
You know, I read your resume many times. Very impressive. If you would, just a quick overview for our viewers who are new to the show, a little bit about yourself and your background, Doc.
Yeah, so I trained in head and neck surgery after completing medical school here at the University of Louisville, and became board certified in head and neck surgery before I did plastic surgery, and board certified in that as well. And went on to do a fellowship in cosmetic surgery, so lots of training. I think I was 35 or 36 years old before I actually was completed with my training, and now specialize in cosmetic surgery, all facets of cosmetic surgery, and non-invasive techniques, office-based treatments. My cosmetic surgery practice is primarily head and neck, facelifts, eyelids, noses, that sort of thing, and also doing breast and body contouring as well.
You know, when I describe your work, the words I like to use are natural, subtle, but yes, you will look younger. You'll feel better about yourself. And I always talk about the benefits that perhaps people don't see when it comes to confidence. You know, the workforce out there now is very young. It's important to look young, feel young, and these are things that you really help with that aren't seen with pictures.
Well, I think that's true. You know, so many times we see plastic surgery on the TV and in movies it's just not portrayed as accurately as the reality is, that these are, you know, typical normal people having procedures that generally make them feel and look better. And I think if we can do that without significant protracted downtime and have natural looking results that don't look like plastic surgery, I think that's really key. You know, in Louisville, Kentucky, there's not a lot of people that really want to look like they've had surgery, if you know what I mean. I think if you look at LA and certainly on the coasts of Florida and New York, it's not uncommon to have people that really don't mind looking done, and I think in Louisville it's a little bit more of a conservative town, and we're looking for results that are more subtle, that make a major impact on people's lives.
I love the way you put that. You're right. We talked a little bit about your medical background, but your true report card is really your work, and I know you're very proud of your work, and I don't blame you. I love the fact that you'll put out, a lot of plastic surgeons won't put on before and after pictures, but wait till you see some of these, and we're going to start with them right now. This is it okay to, I guess, a facelift? Yes.
Yeah. This is a facelift with a rhinoplasty, and we performed contouring of the neck. I think if you look at the before on the left and the after on the right, you can see it's a natural looking result. I don't think that she looks particularly done. I think it looks very natural, and this is something that her friends are going to maybe notice, but it's not something that's going to turn heads in terms of a real obvious surgery result.
Yeah, you just look, maybe you look a little fresher, a little, you know, revitalized, younger, obviously. Okay, what are we looking at here, Doc? Another facelift.
Yeah, this is the side view of that same patient, and I think you can see, I think it's really important, a couple of things that I look for that are important in a natural looking result is that the face itself doesn't look pulled. There's not that kind of strange, weird, windswept look that we sometimes see with facelifts. The neck is surely improved, and I think the jawline is really well defined, but it just doesn't look pulled, and I think almost looks like she, you know, lost a significant amount of weight, which she did not. I combine liposuction of the neck with this procedure. That's kind of routine. If there's some fat in the neck, we address that with liposuction and then do the neck and the lower facelift.
I want to remind folks who are watching, if you have any questions about plastic surgery, 571-5266. 6'3". Dr. McGuire is more than happy to field those. All right, now we're looking at a face and neck lift again. Yes.
Yeah, I mean, and I think, you know, on the left, the before picture, you know, just looks a bit tired. I think you look at the neck in particular and some of that sagging skin. We even see those bands, those vertical bands that go down the midline, which is a sign of aging. Sort of the lower face jowls, which we oftentimes see, and that's just a function of time and gravity. And I think the after result, again, looks very natural. Doesn't look that she's overpulled, and it's not obvious necessarily that she's had surgery. I think it looks really natural. And if we could look at the side view, yeah, this shows, I think, the contouring of the neck and the definition of the jawline, I think, looks really good. The chin itself is well defined, and that's not the result of a chin implant or anything else, but is really just the result of contouring of the neck and the jawline itself. I think the lower face is really improved and doesn't look like she's had surgery.
All right, let's take a look at the next shots here. I think we're going to go, here we go, eyelid surgery. Boy, do I need this. Get rid of my luggage. Talk a little bit about this patient.
Well, and this patient primarily focused on the upper eyelids, and I think you can see clearly that on the left-hand side, there's that excess skin of the upper eyelids. There's that hooding all the way across, and then particularly on the outside, there's that excess skin that kind of hangs over. And it just looks tired and kind of drawn. With the after picture, you can see a really good definition of the upper eyelid crease. We've gotten rid of that excess skin. I think she looks natural without looking surprised, and she just looks well rested. So we're able to do that with, you know, the incision is hidden within that crease, so there's really not a visible scar when it's all said and done. I think that's really important. Another example of eyelid surgery. In a frontal view on the left, you can see clearly there's some excess skin, particularly on her right side, our left, and it's the hooding that's apparent on the outside. You look at the after picture, and I think again just looks really cleaned up. Better definition of that eyelid crease. Just looks more awake, alert, and rested.
I would agree. All right, let's take a look at the next shot. Another eye shot.
Yep, so a gentleman with upper and lower eyelids, and I think you can see significant improvement in the upper eyelid skin excess, no visible scar, which is important, and then the lower eyelids, we're just dealing with some excess fat and also some excess loose skin, fine lines, and crepiness of the skin. You know, these are outpatient procedures with fairly quick recovery and downtime. A couple of examples of my rhinoplasty. This shows a pretty significant improvement in not only the nose but the neck as well. We did some liposuction of the neck. The chin and the nose are really related, and sometimes improving one makes the other look better. And I think it's really important that they're both in harmony. An example here, again, of a rhinoplasty, but this was also combined with a couple of procedures, including liposuction of the neck, a forehead or brow lift, and then upper eyelid surgery as well. So pretty huge transformation. Again, I don't think looks unnatural and looks just really well rested.
I agree.
These are examples of neck contouring procedures. This is just with liposuction, so this is not a formal neck lift. Really minimal incision, just a small incision underneath the chin to perform liposuction and kind of contour that neck, define the jawline, and kind of improve that angle between the chin and the neck. Again, another example, this time in a man, and I think you can see significant improvement in the neck. What's interesting is we get a significant amount of skin tightening with liposuction of the neck in the right patient that's got good quality skin, that's got good elasticity. We can get a lot of skin tightening with this procedure, and that's different than liposuction of other areas of the body. For example, if we're doing liposuction of the abdomen, we have to worry about creating loose skin. And with liposuction of the neck, it's actually the opposite. We actually get some skin tightening. Here's an example of a tummy tuck. I think a pretty substantial improvement, both for the excess skin and for the fat. Pretty significant scar preoperatively. On the left, you can see a vertical scar in the middle. Down from the belly button, we were able to get rid of all of that and also get excess skin and fat removed with a really nice result. Another example of a tummy tuck, I think it's important to note that with a tummy tuck there is a substantial incision that's made, so that scar is fairly large. We keep it low, in fact can hide it in a bikini line usually, and it fades well. This after picture is 3 months after surgery, so the scar is still pink and it fades nicely. Another example of a tummy tuck, again with some excess skin and fat removed, nice improvement in the contours of her abdomen. The scar is kind of dark in this particular patient. That fades to some degree, and it's hidden well within the bikini line.
Wow, if you're not encouraged now, Physician Center for Beauty, that's who you call. And I'm going to give you yet another reason, because we have a special for July, Doc. If you don't mind, go over this special. I love the fact that you bear gifts when you come to the show. Thank you very much.
Yeah, we're always trying to promote different products and services that we offer, and SkinMedica is a really premier skincare line that's physician-directed. It's only available in physicians' offices, usually a dermatologist or plastic surgeon's office. Among the lines that we carry, including Obagi, SkinMedica, and Aven, Glytone. We really like SkinMedica. It's a good product. The TNS Essential Serum is one of my favorite products. I personally don't use a lot of products, but we do use TNS Essential Serum, which provides a lot of different benefits, and as a single-only product, really is my choice and is really my favorite. The special that we're offering for the month of July is with the purchase of a TNS Essential Serum, we're offering a free Essential Serum with a free TNS eye repair or the Physical Daily Defense Sunscreen as a free gift for that purchase.
All right, if you have a question for Dr. McGuire, 571-5263. There's the number, Physician Center for Beauty. Make your appointment today. They will book up really quick. All right, your question's coming up, and we're going to talk about cool sculpting next on Wave 3 Listens.